My name is Sanjay Gupta. I'm a cardiologist in York, and today I wanted to do a video on the subject of honouring dignity in aging and dying, especially in the context of hospital versus home care. Now, many of you know that I lost my father about 4 years ago. He had been declining for a while, and towards the end, I knew that he didn't have long left. I also noted distinctly that as he got worse, as he got frailer, his hospitalizations increased. And every time he would come from hospital, he would be even frailer. And he absolutely hated being in hospital. And when I look back and I think of that time, I'm always sad. But there's one thing that really comforts me, and that towards the end of his life, I brought him home to die. We knew he didn't have more than a few weeks left. He was in hospital. The doctors kept wanting to do more and more. And my mother and me sat down together and we said, we don't want to prolong his life and with it his suffering. We want him home with us, amongst his people, in his bed, in his environment. And we brought him home, and after a few weeks he passed away peacefully in his home. And that has been one of the most comforting aspects of this for me whenever I think about it. Now, this was my experience as a son. But as a doctor, I've seen many elderly patients at the end of their lives, and not just in clinical crisis, but in existential distress. And what I've learned is this: the most important thing for many older people is not more procedures, but to be at home with dignity and in peace. I think it's important to appreciate what hospitals are like for the elderly. The environment is often cold, the lights are often fluorescent, the faces are usually unfamiliar. Sleep is disrupted, there is loss of autonomy, there are dehumanizing routines. Even basic needs such as hygiene, warmth, comfort are often compromised. The unfamiliarity causes confusion, and with confusion you have falls, and with falls you have hospital-acquired infections and delirium. In my experience, what many elderly patients actually want is to remain in familiar surroundings, near their family. They want to be able to eat when and what they want. They want to avoid invasive procedures that they don't understand or desire. They want to maintain control over the little things: their clothes, their routines, their silence. There is this myth of trying to do everything, and medicine will often default to saving lives at all costs. But for an 88-year-old with dementia and heart failure, what does saving mean? Resuscitation, tubes, endless tests. Not healing, but prolonging suffering. True care means asking, what matters most to this person? And that is why I think we have to start thinking about the power of home-based care. Palliative care at home improves quality of life and emotional well-being. Patients feel more dignified, relaxed, and less fearful. And it honors the idea that death is not failure, it's part of life. And families too are comforted when loved ones pass peacefully at home. And this has certainly been my personal experience. I think we need to be advocating for advanced care planning, discussing wishes with the patient before a crisis. And I think we need a lot more resources for home-based palliative and community nursing. And doctors need training to allow them to recognize when the goal should shift from cure to comfort. It's important to respect that staying at home is not giving up. It's choosing how to live and die on one's own terms. I believe the greatest kindness we can offer an older person is not another scan, but the right to stay in their own home, surrounded by what makes them feel like themselves, until the very end. If you have witnessed a loved one experience unnecessary hospitalizations at the end of life, or even had a peaceful passing at home, please do share your story. If you believe dignity matters more than intervention, then do let me know. Again, another conversation that we must keep having. All the best.